Wow. Today's episode is part one of a two-part series with Dr. Federica Amati on the first 1,000 days of life.
Everything that happens in the first 1,000 days is what sets the slope for your aging later in life. I was very surprised to see just how much of our health is decided so early on in our lives, before we're even born. You start to understand things that actually you've had your eggs since before you were born, and the exposures that these eggs have had can impact their health. I don't want to scare people into thinking, oh my gosh, all the late nights I had in my 20s have completely ruined all my eggs. It doesn't quite work like that.
Are the things that would encourage and promote good sperm health the same as egg health, or are there differences?
The first one that jumps to mind is
Are there any foods or food groups or drinks that you think are best avoided completely?
Yes.
Pregnancy, in your words, is a high protein requirement task. How much protein do women need per kilogram of body weight basis?
I wouldn't obsess about the grams per kilogram anyway, but I would say,
what's the golden window of opportunity?
the golden window of opportunity is a period in time that we refer to in medical science where so much health is set, so many things happen, that there's just the most opportunity to have a long-term impact on a person's health. And in terms of what that time frame is, it's really the period between conception and second birthday. This is also known as the first 1,000 days. And, sometimes people like to say, actually, it's technically 30 days preconception and possibly up to the age of 3. So the golden window is a little bit stretchy, but it's all anchored to this principle called DOHAD, which is the developmental origins of health and disease principle, which essentially speaks to the fact that all of our organs are formed. Most of our cells are sort of set in terms of their health in the first 1,000 days of our lives. And it's called the golden window because the positive of this is that if we intervene in this time frame, we can have really measurable long-term positive effects on the health and the life of that baby.
And when you say intervene, that's thinking about what parents are doing preconception, during pregnancy, and then how a baby's being fed?
Yes, it's what parents are doing. But Simon, I think it's important to frame very early on in this conversation that it's also the kind of environment that we live in, which is shaped by the policies and the political will to make sure that the best possible environment is created. So as you'll be aware, lots of policies and lots of the ways that we structure things like hazard for pollutants, for example, is centered around adult health. So we think of things as being safe limits or even healthy pollution levels for adults. And actually, if there was a better understanding of the importance of the golden window of opportunity, and it was part of the way we think about structuring our environment at policy level, we would really shift the way we think about these things. So yes, it's parental knowledge, empowering parents to know that they have so much potential they can do here, but it's also taking the blame away from parents and letting them know that actually at the moment in many countries, it's quite hard to set up the best possible environment for this time frame.
And why is this important? Like, why are you so passionate about this, setting up the best possible environment, helping to educate and inform parents and policymakers? What are the consequences, I guess, of not getting this right? And what's up for grabs if we do better in this area?
I'm really passionate about it because there's just so much potential for it. And also because when I started doing research into this, started looking into this about a decade ago now, no, actually maybe longer than that, I was very surprised to see just how much of our health is decided so early on in our lives, before we're even born most of the time. And this transgenerational effect, the fact that we now know that some of my health was set when I was a cell inside my mother as she was developing inside her mother's womb. Like, that blows your mind when you think about that, right? So, Simon, the egg that became you was already forming inside your mother's tiny, tiny ovaries when she was inside your grandmother's womb. So there's this, once you start to look at this, there's a transgenerational effect. It's really the longevity lever we have never talked about. Like everything that happens in the first 1,000 days is what sets the slope for your aging later in life. So we should really be thinking about this in a much longer term way. So I was excited by the prospect of what the evidence is showing us. You know, a lot of the evidence we have around this hypothesis, the Dohad hypothesis and transgenerational effects, comes from quite tragic things like famines and, you know, what happens when things go wrong. But what it's allowed us to understand is that there's something we can do to intervene to make the outcomes for the mother and for the baby, both in the short term and the very long term, and that baby's offspring. So to me, it's the most bang for your buck you can possibly get when we think about public health interventions. And I'm passionate about it because it's just not spoken about. It's not something that's often communicated clearly. And it's also something that, frankly, when we think about the way that public health, medicine, and policy sort of evolve, they often don't have this longer term thinking. And because at any one time, there's only a proportion of the population that is reproducing. So it's technically like a minority of the adult population that's reproducing. It means it's never a huge target. But as I said, the potential for the effects of what you do there is huge. So you asked me what can go wrong if there are some negative inputs at this time. And I mentioned like there are things like the Dutch hunger famine, which you'll know about. It was a natural experiment, if you will call that, where the Dutch population was starved as part of the Nazi takeover. And essentially, there was this cohort of pregnant women who entered famine at different points in their pregnancy: first trimester, second trimester, third trimester. And because this is a whole population, scientists were able to follow up and see how that famine kind of changed the outcomes of the offspring that were pregnancy at that time, that were in the womb. And there's some very distinct effects that that famine has on the baby, especially in the first trimester. So horrible events such as the Dutch famine and other things that we see, such as exposure to phthalates in the first trimester, have measurable effects on that offspring's outcomes, basically. And so we have a few ways of understanding why and how this happens. And we have human data that shows us that these very sensitive windows of exposure have lasting effects on the outcomes for the offspring.
I want to come back to famine later on when we tackle GLP-1s and pregnancy, and get your thoughts on that and what we understand about GLP-1s, which are, of course, super popular. You and I did a different episode on satiety and appetite and GLP-1s, but I'm sure there are a lot of people that have questions about their use, you know, during pregnancy, pre-pregnancy, etc. Before we get there, in case someone hasn't caught our last episode, can you remind people, and I'm going to get you to brag here for a moment, remind people of your like academic and clinical background, so people kind of understand why you're the right person to be speaking about this topic?
Yeah, of course. So my background is in biomedical sciences and endocrine pharmacology. So I have an honors in endocrine pharmacology, and that's really given me a lot of interest and understanding on how pathways and chemical interactions with hormones basically work in our body. I then went on to do a master's in public health at Imperial College and was very interested in patient-centered outcomes and patient-centered care, so personalizing medical interventions and advice. From my master's, I worked with the WHO for a bit, and then I went on to do a PhD in clinical medicine research. And for that, I actually looked at huge patient data to, again, assess how we could predict outcomes from treatment by understanding patient individual characteristics. So I'm very passionate about how we can help improve outcomes in medicine and health in general by understanding individual markers and individual characteristics. And then finally, I did my master's in nutrition at London School of Hygiene and Tropical Medicine, where I specialized in maternal and child nutrition. And I'm a registered public health nutritionist, and I have an active clinical practice with a full medical team. So I'm the nutrition lead for that. And I'm also the nutrition topic lead for the medical school at Imperial College School of Medicine. So I teach medical students all about nutrition, appetite regulation, the interaction between environment and how that shapes health across the life course. And I'm lucky to have been working with the medical team to create a GLP-1 intervention for our patients that includes lifestyle, nutrition, exercise, and their prescribing doctor all working together. So I've been lucky to be part of a system of how these drugs should be prescribed, and then but also been able to see the effects of what happens when patients come in after they've received their prescription elsewhere, and how that can be quite damaging.
Before we kind of walk through the golden window, through the different stages, so preconception, during pregnancy, postnatal, and think about environmental exposures and nutrition, etc., I want to read you something that you wrote in Everybody Should Know This, your book that's on this topic of the importance of the first 1,000 days. And you said, whenever I want to shout from the rooftops about the importance of the first 1,000 days, I'm met with sharp inhales and various degrees of raised eyebrows. Some podcasters have told me we just can't include that information. It's too scary to the public. Do you find that people are quite scared by the idea of this topic, and as a result of perhaps various things being outside of our control, some of those things that you mentioned earlier being more related to the environment that we live in, prefer to avoid this topic because it is quite sensitive and frightening?
Yes. So I think there is a real sense when you start to unpick this topic and just see how much influence this period of time has, there's a reluctance to engage with it sometimes because if you're a parent, the guilt of parenthood is already quite widespread. You always try to do your best as a parent, and when you hear that there's even more of pressure of what could be done in this time, it can feel quite overwhelming. And even if you're not a parent, often people find this information can be disempowering because it's like, well, I'm not in my mother's womb anymore. What can I do now to improve my health? So there's this dual element of, oh gosh, I'm already a parent and perhaps I'm past the 2-year birthday mark. It's all lost. And then there's an element where it's like, well, my kid's 12 or I'm 25. What can I do now? And I think that's not the point of this science or of communicating this science. I think that, as I mentioned, this is an opportunity to reframe longevity to start much earlier. And there is also a case, of course, the rest of my book covers this, that improvement in lifestyle and nutrition improves our health at every phase of life. So one of the most famous modeling studies on this was looking at what would happen in using UK Biobank data if somebody switches to a healthful diet at the age of 70. In this study, they modeled a potential increase in lifespan of 6 years. That's nearly 10% of your life. So there is always positive outcomes to be had by improving lifestyle and nutrition at any stage of life. But I think avoiding the importance of this phase because of potential guilt misses the point of the framing. It's like, actually, by understanding this, the science is so evident that what we should be feeling is we need to push for change that supports this life period at a structural level. And then there are things that we as individuals can absolutely do to improve the conditions, the nutrition, and the environment that we are bringing new babies, new life into. I think it's a very hopeful message because the science is so exciting and it's getting stronger every year. So even since I wrote the book, new studies have been published that sort of show us more mechanisms and more ways in which these levers can be pulled. And it's an urgent call from us as a population to say, hey, actually, we should really look at this. We should really help to change some of the regulations, the policies, the advertising standards for some of these products so that we can create a better environment, which will also be better for us as adults, by the way. So we all share with the benefits, right? It's just that the incremental benefits are so big when we think about the first 1,000 days.
How would you encourage the listener who, let's say, their